Okay, good morning. This is January 4th, and we are the Senate Committee on Health and Welfare. I'm Chair of the committee, Senator Ginny Lyons, and we're joined today by all of our committee members, Vice Chair Ruth Hardy, Senator Cheryl Hooker from Rutland, Senator Ann Cummings, Washington County, and Senator Josh Terenzini, also Rutland County. And we're really lucky today to have our new committee assistant. It's been a long time without having a committee assistant. Erin, welcome to the committee. We're glad you're here. And why don't you just briefly introduce yourself to us and to others who might be Zooming in or watching.
Thank you. I'm Aaron Zenaymer. I'm the new committee assistant for the Senate Health and Welfare. Also a fairly new Vermonter, but excited to be here.
Okay. And Aaron is the go-to person. Should anyone wish to testify in committee, just contact Aaron. You can copy me on your email if that's how you're communicating. And then as your issues are taken up, we can make sure that we have your information. Okay, so we have a quick and a pretty short looking agenda, but we do have a lot of bills and a lot of topics that are before us this session. Before we begin, I'd like to say that I know how busy everyone has been in the off session. Each of us has worked very hard on a task force or committees and have put together reports for either our committee or other committees. So it's been a never-ending life of work for the Senate. I don't know whether and how much folks out in the viewing world appreciate that, but I'd like to emphasize that because as senators, we do respond to our constituents. We work with our constituent groups, and then we're also greatly involved with Senate work in the off session. For me, and I think for others who are here today, this has been one of the busiest times that I can remember as a senator. And I do think we've accomplished a great deal, but that does bring a great deal into our committee as the session begins. So I'm going to go and ask each of you just to introduce yourself. And if you don't mind sharing the other committee that you're on, and then briefly what your primary interest might be this session. So I know we all have 1,000 primary interests, but pick out one or two things that you're interested in, and we will get to a broader discussion of our interests as time goes on. So I'm going to start with Senator Hardy.
Thank you, Senator Lyons. I'm Senator Ruth Hardy from the Addison District. I also serve on the Senate Finance Committee with Senator Cummings. And since you mentioned off-session work, I was busy during the off-session along with Senator Hooker on the task force on the implementation of the pupil weighting factors report, which is a long name for a very complicated issue. Related to this committee, obviously we're still in the midst of a very traumatic and ongoing global pandemic. So I think my priority is to continue our work to respond to the pandemic and all of the many facets of our life and our healthcare system that have been impacted by the pandemic. And following up on the work we did last session and the session before that, and making sure that we're taking care of Vermonters. So that would be my first priority. And then there are a lot of bills related to, I think, things that impact families that I'm particularly interested in: childcare, some maternal health issues, access to healthcare issues. and then just sort of broader looking at our healthcare system and healthcare reform, especially in this year when we're renewing various agreements. So a lot on our plate for sure. Thank you.
Thank you. Senator Cummings.
Okay. I'm Senator Ann Cummings from Washington County. When I'm not in health and welfare, I chair finance. And we tend to all try and work together. Primarily, I'm interested in making sure we make the best decisions around our public health response to the present pandemic and to making sure that we come out of it in good shape with as little damage done to our people and our economy as possible. I've been interested for many years, having been through the single payer healthcare work in the Senate and also on controlling pharmaceutical costs. And those are ongoing issues for me. Coming out of the pandemic, I'm concerned about some areas of our healthcare system that are struggling, mental health, long-term care. A lot of that is related to workforce shortages. So I'm going to be looking at those. I think that's enough to keep us busy.
What are you going to do the second week?
I haven't thought about that yet.
Okay. Senator Hooker.
Thank you. Thank you, Senator Lyons. So many things have already been spoken of, but certainly dealing still with the pandemic, especially with regard to mental health. There are a couple of bills that are coming to our committee that I hope that we can look at, and also to utilize the money that's coming from the federal government in the most effective way, so that we can help Vermonters get through the pandemic and to support our healthcare system. There's a lot to talk about healthcare, but those are some things that I hope that we can focus on, making sure that we're utilizing the funds that we receive, the resources that we have, in the most effective way for the long term, not just the short term.
Good. Thank you for that. I think the House will be starting with the Budget Adjustment Act, and some of the federal dollars will be there. So we'll get our look at that going forward.
And I just forgot to say that I'm also serving on the Education Committee, and I'm also the whip for the majority party. And we hope to look at issues dealing with huge issues in our state, which are housing, workforce development, and climate in all of our bills.
Terrific. Senator Terenzini.
Oh, good morning. Thank you, Senator Lyons. And it's so nice to be back and to see all my committee members that I serve with. Josh Terenzini, Senator from Rutland County. This is the second half of my first term. A lot of good things that you've already mentioned, Senators. A couple others that I just took a quick note on. I think it's a real nonpartisan issue everyone can get behind, is our nursing shortage that we have in the state right now. I was glad to see the governor and Senator Sanders and the pro tem discussing this recently. Over the next 10 years, it's really actually frightening to think about how many nurses we're going to lose through retirement. And we have literally thousands of nursing vacancies that will be coming up in the next decade that we need to really figure out. I'm glad that we were able last year to pass the Nurse Compact bill. And I'd love to, in the next few months, find out if that's had any impact on or any success rate with getting nurses here. Another one that's near and dear to my heart that I know Senator Lyons and I have talked about a lot, I hope that we can get to, is S90. It's establishing a health registry for those who have ALS. And so I hope that we can tackle that here in the next coming months. And like I said, I'm excited to be back and to get the work going. So.
Yeah, this is terrific. I think everyone's mentioned some of the really critical issues that we have in front of us. And we do have bills that relate to each one, and there may be some things that we can do to improve or change those bills to expand the work a little bit. The pandemic, I couldn't agree with you more. We'll be looking tomorrow. We'll be working with the House Healthcare Committee and looking at Act 6, which was the statutory provisions relating to the emergency. So we'll look to see which licensing and regulatory changes we might want to continue, and we'll have some testimony on that. I know that Lauren Hibbert from the Office of Professional Regulation will be bringing in her ideas for us. So that'll be a good way to begin our work on the pandemic. And obviously that's just one way we will work on the pandemic. The issue that you brought up about workforce is key. Erin, right now, as I've communicated briefly with Ina Backus, our healthcare reform director, and we'll be looking at the workforce report that we asked for on healthcare. So healthcare workforce improvements. And again, there may be some other bills in our committee that you or others have introduced that will help us expand a little bit on the workforce recommendations that come to us in that report. I did send it to Aaron. Aaron, you have that report. He's going to be putting it up on our webpage on the day that Ina Backus or her team comes in. And I'm wondering, Aaron, if you wouldn't mind sending that workforce report out to all members of the committee
Read it.
so that they can look at the recommendations ahead of time, because that seems to be an issue important to all of us. So Aaron, can you do that?
Yes, I can.
Thanks, that'd be terrific. In terms of the nursing shortage, that's infused within or embedded within the workforce issue. I'd just like to share a little bit, if you don't mind. I've been working on workforce issues for many years in my professional life. I directed and developed many allied health and other programs and worked to expand some of those programs, and including the possibility of having a public health program in our state, and UVM has recently put that into place. So there are a lot of opportunities for us to look at how to expand workforce, and that may be in conjunction with the Education Committee, or we may be able to make recommendations to the Education Committee. One of the things that I did in the past was to do a market analysis for the state of Vermont on healthcare workforce needs. And I have to say, the reason I bring this up, because historically things haven't improved. And the more, the more we think things are going to change, the less they do. So we can think creatively, and we can move ahead in the workforce area. It is absolutely critical, and all the gaps have been demonstrated during the pandemic and continue to be exploited. So that's an important one. The other area that I think, as you've all mentioned, is mental health, and that leans on kids, schools, parents, adults, substance use disorder, and we'll work alongside of our companion committee and human services and our companion committee in the House Healthcare. So they'll also be looking at some of these issues. They are separated. So mental health is in one committee, and then substance use disorders in another, but the linkage there is key. So we're lucky because we can pull those things together and look at the bills that we have. So you all have mentioned all the important things, from healthcare reform, access, affordability, to workforce. We have a lot in front of us. And I am very excited about the work that we can do going forward. We'll have some reports coming in. The Child Protection Oversight Committee, the audio only report we'll be looking at tomorrow when we have our joint session with House Health. We also have,
Hey, Ginny. Oh,
yes, sure.
I'm sorry,
Go ahead.
Senator Lyons. Sorry.
Yes, Senator Hardy.
Got to get back into the swing of things here. You mentioned the audio only report. I know it was emailed to us last month, I believe. Time is weird lately, but is it
should
also
be-
on our website?
Aaron, is that one's up on our that report is up on our webpage?
All right, the telehealth report?
Yes.
Yes, it is up.
Yeah. Okay.
Great. Okay. Thanks.
You have it. Yeah, that's good. That's something to think about. And we have a little catch up to do there to hear about what decisions were made by DFR and how that's going. So that there's more than just the report. So we'll see what we need to do there. We're going to be dividing up the work with House Healthcare. They may start on some of the things we're looking at tomorrow, but that's okay. But we'll certainly be formulating our own ideas as well. Let's see, now Josh mentioned S90, which was a bill I think we all signed on to and feel is important. We will be taking that up. We will be taking up some of the other bills that we currently have in our committee, and then others that are coming to us. So we have the Child Care Advocate Bill that we just got today, H265. We'll have S74, which is a technical correction bill. We'll be looking at that tomorrow on the end of life choices. We'll be looking at S91, which is the Parent-Child Center bill. That's been highlighted by the Child Protection Oversight Committee as something to look at. So there are a lot of bills that we have in committee that do have some support and that we will follow up on. I've just mentioned a few, and the ones we're looking at tomorrow are just the beginning. Then we also have all the bills that all of you have introduced, and we'll go through as many as we can and try and put together some healthcare reform policies and some prescription drug policies and maybe some regulatory improvement policies. So there's a lot for us. That's just my bit of a ramble. I will say this, we will meet weekly. I will meet weekly with Ledge Council and put together an agenda for us every week. We're going to have to go with the flow because we know that our Ledge Council is extremely busy. And so we're going to look at bills when Ledge Council is available, at least for the initial walkthrough and discussion. For testimony, we may not need to have Ledge Council present, but just so you know that there's a lot of juggling that goes on behind the scenes, not just with witnesses, but also with our staff to ensure that we have the support we need. Then, and as you know, Jen Carby is now the lead counsel for our lawyers, and we are so fortunate that she is going to be continuing with us. She's very, we can't lose that support. In terms of mental health, I think we have a couple of bills. Senator Hooker mentioned some that are coming to us that I think will be important to look at. We do have a suicide prevention bill that we can look at. And I know that Senator Hardy, you have some ideas about looking at public health issues related to suicide, and we want to do that. So we have a lot in that area. And I think we have some other reports that we'll be looking at, but the big ones I've mentioned. Tomorrow, we've been invited by the Judiciary Committee and the Institutions Committees to attend a meeting with them at noontime. And this is important in terms of kids who are in need of support in the judicial system. But so children who, kids who go into the judicial system may or may not be adjudicated and then sent to a facility of some type or given a specific treatment program. But one of the things that we find out is that there are a lot of kids who don't go into the judicial system, but are also handled similarly within the Department of Children and Families. My concern is that we not allow for these kids who are less violent not to receive the important treatment that they need to have up front. And we know when we say that we don't have the workforce to treat everyone. And so if you can go to the meeting tomorrow and listen, one of the areas to listen about is, do we have a secure therapeutic environment for kids who are violent? And what kind of a therapeutic environment or treatment do we have for kids who are less violent? A fine line there. Department of Children and Families is very much in the lead on a lot of this, as is the judiciary. And I want to ensure that our committee stays engaged in this discussion. I don't know who can go tomorrow. Senator Hooker.
Is this going to be virtual or is it in
Yeah.
person?
Yeah.
Okay.
Yeah.
So, and has somebody sent us a link?
Just send us the link.
I think Peggy Delaney. Aaron, can you double check that for us and make sure that the entire committee, I'll go back and check. I know I've gotten an invite. I think everyone here has, but Aaron, can you check with Peggy Delaney and make sure that the invitation has gone out?
Yeah, I'll do that.
Okay, that'd be great. I can be there for about 15 minutes and I'll try and get there after my 12:15 meeting. There's so many gray areas in this world, and this is one of them. How do you treat these children and how do we provide support? And it's such an individualized area of mental health and support. It's going to be interesting. So our schedule will be pretty intense. Next week, we're hoping to schedule the task force report from the Affordable Accessible Healthcare Group, the task force. It is, there's some complicated information, but there's also some great opportunities for us. And along those lines, one of the areas that I have a great interest in is in primary care and moving our primary care agenda forward and ensuring that people have access without out-of-pocket or co-pays for primary care. That can be integrated in with some of the recommendations that we should see from the task force. I know that the Green Mountain Care Board is also looking at primary care, and when we get there, I have a short article that I received that I can share with you from the American Academy of Family Physicians. So there's opportunity for us to move forward in a lot of areas, and I think taking some steps that seem small but I think are pretty big will help us go ahead. We're going to get reports about hospital financial sustainability. The hospitals want to move that again. They don't want to, they're very busy right now. And so doing the work on the sustainability planning is difficult for them. So we'll try to see what we can do to accommodate. We already suggested that they could put that off for another month or two. So we'll see what happens. Oh, I have a specific question. Senator Hardy, you introduced a bill today on the maternal health Medicaid extension. That I know that DEVA is also interested in making that happen, and it has to happen very quickly. And I've been in communication with Senator Kitchell about having that included in the budget. And so is that something that you could tolerate? I think, can you want to explain what's in the bill? Why don't you do that?
Oh, sure.
And then we can talk about it as a committee.
Sure. I think the bill, I think most of you or all of, I'm not sure, all of you, I think are co-sponsors to it. And it's a provision that was included in the American Rescue Plan Act, ARPA, that allows states to extend postpartum coverage for pregnant women who qualify for Medicaid, to extend it for a year postpartum. Right now, it's, I think, only 6 weeks, which is very short. And this is an opportunity to have the feds pick up most of the tab for doing this, and also, more importantly, to help with the postpartum health of mothers and their new babies. I believe the deadline for states to do this is April 2022. So we only have a couple months to do it. The bill basically is just directing the administration to do it, but I think they're on board.
They're doing it.
And they've started the ball rolling, but they need sort of the legislative authority to do it. So if we could do it in the budget adjustment, I think that would probably be the fastest and safest way to ensure that we get it done. I would be happy to have that happen. Jen Carby probably has more information. She's been working on this bill. There's a companion bill over in the House as well, so they may even stick it in the budget adjustment on their side before we even get it, but I don't know what their plans are. But yes, however we can make it happen, I want to make sure we get it done.
Terrific. And with that, I think that is the intent. I think that the House is interested in moving that as well. And so moving it into the first possible bill is the way to go. Are we okay with that? I'm looking at each of you. I'm shaking your head. Yes, that's great. So I'll get back to Senator Kitchell, and it'll be in her hands to make sure that happens. And she does have the language. Since the bill is now written, the language is there, and I think she would be happy incorporating that. And thank you, Senator Hardy, for putting that in. I think it was important. There's a huge amount of information out there right now regarding postpartum depression and how important this is. I can't imagine what having a baby during the pandemic has been like for people. Difficult.
Yeah, it's really isolating in general to be a new mom, and during a pandemic, it's even worse. So
even worse.
Yeah.
Exactly. Yeah. So, I think we have a lot in front of us. I think that we're probably okay for today. Does anyone want to pick up another topic or have a conversation about how we're going, where we're going, issues? We're going to put as much as we can out on the table as quickly as we can. I know that there are concerns about long-term care. I received an email today that I had received. This is the third time I've gotten the same email about the long-term care premiums going up sky high, or being raised 189%. That might end up in as both a finance and a healthcare discussion, but my concern is that we not lose long-term care in our debate and discussion around healthcare reform. Our demographic is changing radically, and we're seeing a great need in our state for home care delivery, as well as perhaps nursing homes eventually. But so that, Cheryl, do you have a question? Or
Yeah, just
Yeah.
another topic. So
Oh, good.
wait for you. Yeah,
I like topics.
recovery centers.
Oh, yeah.
They have been struggling through this pandemic. I mean, the increase of their workload really has been exacerbated by the pandemic, and they were looking for an increase in their base. And I don't know, Senator Lyons, if that's something that we could talk about with the Budget Adjustment Act, or if that has to go to the big bill. It's but that's something that I think we need to put on our radar.
Yes, I'm with you. We advocated as a committee, if you recall, we advocated for adding some funding for recovery centers. And then the Appropriations Committee picked that up
Funding.
and did that. I mean, it was great. So we've had requests for base funding improvements from a lot of folks. I mean, so I think base funding, in particular for Medicaid, is a critical discussion that it will involve us as well as other committees. So it's hard to say we want to increase base funding for one and not the other, but I couldn't, I just can't agree with you more. We need that base funding increase. And then you look at our primary care environment and our nursing environment, we need base funding increases. So big discussion. We'll pick that up. H-153 that we're looking at tomorrow is for some of the long-term care facilities, base funding increase. It was passed to us from the House without, I think there's a fiscal note, and we'll try and get that from Representative Noyes, but there was no dollar amount in the budget from the House, just the bill. So that might be the vehicle we need, Senator, for a broader discussion.
150.
And I'm open to that.
Okay.
And I don't know how open the Appropriations Committee is, and I don't know if Finance wants to find the money for us, and what the state match will be. But it's something at least to consider.
I think if the rumor mill is to be believed, there's going to be proposals for tax cuts. We'll know more after the budget. But we've got a lot of one-time money right now, but for ongoing money, at this point, it's not improving. And so the reason these places are all hurting is because we have not had the base funding to get it, to contribute to it. And that's why I think why recovery centers are having a problem, because they're a new ask. And I'm going to have my committee see if we can get a revenue kind of a projection as to the needs of present services, what it will cost. And
keep us posted on that. I think, I mean, and you and Senator Hardy can keep us informed. That's great.
Well, we've got, every year there's proposals to tax the rich, only we haven't defined the rich. We know half of the folks that are in the top tax bracket aren't there the next year.
Right.
So are they the rich or just lucky?
They won the lottery one year.
Sold off the baseball card collection to pay for their long-term care.
There it is.
Or medical bills. Yeah. And we have proposals, several, to put schools on more of an income based, but how much that is and what the trade-offs are, I think is what we need to have that discussion.
Well, the other thing around that is as we look at the federal dollars available to us and how they might be used. I don't know what we can do for long-term investment with those
Right.
federal dollars.
That's
But
the
that's
other
something.
question.
Yeah, that's a huge question. And I don't know that we ever get a good answer to it because, and now we don't know whether we're going to get the childcare financing dollars that we need.
Mhm.
Hello? And we've got some things in the works in that area that we'll be hearing about on Friday. So
I met with the chamber last week, our,
Oh.
Annual, these are our issues. And I told them they need to start thinking about how we socialize the cost of childcare,
very good,
because
very good.
businesses need it as much as parents and children. And we need to find a way to finance it, and it can't all be state because
No,
we don't
gotta
have the
be
money.
private. It's got to be public private.
Yep. So
There is
hopefully
a
they'll think.
Go ahead, Senator.
there's a childcare financing study that is actually starting up this year that we will have the results of next year.
Right.
So I
Good.
know that they are looking, and we're going to be talking about it, I believe, on Friday a little bit, Senator Lyons, right?
Yeah.
Yeah, and that will be looking at various funding options, including public, private, federal, state, local, blah, blah, blah.
It is,
So-
but it's, I think that's a good thing to remind ourselves about, because then when you go and talk with your chamber, your respective chambers, just reminding them that the public-private conversation's going on and how important childcare is to business across the state. There's just
Mhm.
no question
Right.
about it. And we've talked about this in committee before, so. All right.
For years.
If it just give us the reins and we'll fix the world, right? No.
I'm still keep saying every chance I get, we've got to relook the school calendar, which is based on the assumption that mothers are home.
Yes.
Um,
Yes.
and mothers aren't,
No.
but
And
kids
there-
are, and it's a real problem.
Yes, it is. Oh, okay. And having children is an economic burden in many ways, and people, we want to see kids in the state of Vermont. So,
We need kids.
yeah, we need kids. Thank heavens for
Somebody's got to
Josh.
pay for my long-term care.
Yes.
We need more grandparents to take care of those kids that are out of school because of COVID so that their parents can go to
Well,
work.
that's how I figure I'm paying for the support for long-term care.
Yeah.
So I'm going to suggest, committee, that we wrap, and don't go away. Josh I just want to ask Josh if he has a couple other suggestions around process. I think we're getting into a conversation that we can go off YouTube for now, and we'll come back and be talking about our policy work tomorrow morning, which is a joint meeting. Our joint meeting begins at 9:30 with House Healthcare. Unless you hear differently from me, sign in at 9:15. We'll begin the meeting at 9:30. I'm not seeing a reason to start before then. If there's something compelling, I'll let you know, and we can start at 9. And that'll continue to be our start time unless we need more minutes. So.
Appreciate the ease into the new world of having to be up dressed in something other than sneakers and sweats and online by 9:00.
It's a challenge, is it not? Right?
Where did I put all those clothes last year?
Oh, that's great. Well, okay. So
Okay.
Aaron, why don't you take us off YouTube?